Hey everybody, I put together a brief video on a lot of the common questions that we've gotten over the last several years as we've done our MDVIP program. Remember, we were the first in the country to do this for women's health care, so it's a new concept. So I get the fact that some people are trying to figure out exactly how this works. Well, just as a reminder, we can be both your primary care physician as well as your GYN. It's a hybrid, it's a combination. In other words, we can provide comprehensive medical care for women. So I wanted to just read off a few of these questions and answer them. And my guess is maybe you had some of these questions also. Number one, will I need to see a separate primary care physician? Well, the answer is no. I'll be really able to handle most of all your primary care needs as well as your GYN needs. Now, obviously, if you need extensive care and the need of a specialist, then we're not going to be the cardiologist and we're not going to be the pulmonary specialist, but we're going to function like a primary care. Part of my role is to look at the big picture, to make sure that you've got one person looking at all your medicines. Every year on your annual wellness visit, we look at each medicine and go through what are the pros and cons, what are the benefits and risks. Oftentimes what happens in medicine, and most of you know this, you see a specialist and they'll make a change here, and then maybe you'll see another specialist, they'll change this here, and sometimes things get crossed over or maybe not looked at in the big picture. Well, that's part of the role that we are going to function in this model of primary care. And the question we got was, can I keep my specialist? Absolutely. You will keep all your same specialists. If you see a cardiologist or if you see a renal doctor, you're going to continue to see those doctors. Nothing will change there. The fact that I'm affiliated with MDVIP does not limit me as to who I make referrals to or who you see as your specialists. Question came up, will I use the same hospital or hospitalists? Yes, I have privileges at Piedmont Hospital here in Augusta. And the reality is I'm doing basically office GYN and office primary care. In other words, I don't spend a lot of time in the hospital. And now if you have to go into the hospital, most of you already know that you'll be taken care of by the hospitalist, the physician specially trained to handle hospital-based patients. I'm not doing surgery anymore, so anytime there's any kind of surgical intervention that's needed, I have a wonderful group of physicians that I have complete trust in that I refer you to, but I'll continue to see you. I'll come to the hospital and visit. I'll play a part of your care and certainly will follow up with you after your hospitalization and make sure that everything is going to complete your recovery as rapidly and successfully as possible. Question said, does the annual fee have to be paid all at once? Absolutely not. We have multiple payment programs that allow you to pay quarterly. In fact, that's the most popular choice. You can pay semi-annually or you can pay annually. And remember that there are some HSAs, MSAs, and other of those type of health plans that will allow you to use those funds to pay your annual wellness fee. And we're happy to provide any of the documentation that you need to take care of that. You need to check with your own plan to make sure if that's an availability. We also offer what we call a family plan, meaning that if you have a family member, a female family member between the ages of 16 and 26, I can see that person without them joining MDVIP. So I can see them for their primary care or their GYN needs simply because you are a member of MDVIP. So I do see a lot of mothers and daughters in our program, and that's a special benefit that we offer that allows them to get quality care without actually having to join MDVIP. Question comes up, do I keep my medical insurance? Yes, you'll keep the same commercial plans that you have, Medicare, and I'll file these plans for sick care just like we normally would. You'll be responsible for any co-pays or co-insurance or deductibles. It's really business as usual when it comes to insurance. People ask where the office is located. They knew for many, many years I was affiliated with Women's Health of Augusta downtown. Well, now I have my separate private office that's at 2315 Central Avenue. It's in a nice residential area that is outside of all the hustle and the bustle of the downtown, easily accessible from all over. And that really makes it special because we can offer reserved parking spots literally at our front door, and you walk a few feet in and you're right there. And then finally, I get this question a lot. Are you still open for new patients? Yes. I purposefully have capped the number of people I see exactly for the reason of being able to provide the services that I've been talking about throughout these videos. I'm very cognizant of the necessity of time. I know that if I'm going to offer and provide the quality and the care that I want to give to you individually, that requires time. And that means not having 20 or 30 or 40 appointments a day like many routine primary care or GYN offices have. We have purposefully limited the number of people we see. Now, recently we've had a few folks move out of town. Unfortunately, a couple of our older patients have passed away. So we do currently have a few spots before we reach capacity. At that point, we'll start a waiting list. But if you're interested, we do have a few spots, and I'd love to talk to you further about it. That sometimes is the best approach, is if you have additional questions or concerns, feel free to give us a call at the office at 706-842-4210. And let's just set up a time to talk on the phone or talk one-on-one, and we can explore what your particular needs are. If you have any additional questions, we're always available to answer those. And remember, make healthy choices.